name's Dr. Raymond Haroun. I'm Director of Spine Surgery here at Saint Agnes Hospital. I'm glad that you were able to join me this afternoon. Today we're going to talk on the topic of cervical spine disease. That's basically neck pain and other ramifications from neck pain. So, what are some of the causes of neck pain? Now, neck pain is one of these black boxes. It's kind of like back pain, meaning that many things can contribute to neck pain. For example, if we take a look at the neck, which is the spinal column, you can see that there are discs between different vertebral bodies, and each one of these levels represents a vertebral body. This is the back of the skull. Here's C1, which is the top of the top of the spinal column. Here's C2, C3, C4, C5, C6, and C7. So there's 7 cervical vertebral bodies. And in between each vertebral body is a soft disc. That disc is the shock absorber of the neck. It's the cushion of the spinal column. Now what you see here are little channels, and I'm going to use my pen here. There are little channels through which a nerve root comes out at each level. So basically, we have several nerve roots, C2, C3, C4, C5, C6, C7, and C8. Those nerve roots go out to our arms and supply our arms with sensation. They supply the firing to the muscles, which causes contraction for movement and coordination of our fingers, arms, and hands. Now, when everything works perfectly, you can see it's a very complicated system, because here you have vertebral bodies, building blocks. You've got nerves coming out. Running in the center through here is the spinal cord. This blue pen, in a sense, represents the spinal cord. And off the spinal cord comes the nerve roots. And you also have to remember that this moves. So this is in motion constantly. So when you're playing lacrosse, softball, swimming, your neck is constantly moving. So the beauty of the spine is that it's functional. It moves, it turns your head so that you can see things, it provides strength. There are blood supplies as well. There are vertebral arteries that go through these bones up to the brain to supply the brain with oxygen so that it can do its job as well. So that's when the spine works perfectly fine. However, during the course of sports, things around the house, the neck can be subject to some kind of disorder. And what do I mean by that? Say, for example, you were playing rugby or tennis. There are muscles around the whole spinal column. Those muscles can get disrupted and can lead to neck pain and neck discomfort. Now, that typically goes away after a few days with Motrin, Aleve, ibuprofen, icing, heat. However, if the discs become injured or the joints become injured, then people tend to get chronic neck pain. And that's typically more prevalent after the age of, say, 40. Now, there's no defined age, but basically, as we get older, or as I like to say, as we get wiser with each passing year and we become more knowledgeable, our body doesn't keep up with that wisdom, so to speak. And the body starts to wear out a little bit. So basically, the discs wear out. Those shock absorbers are filled with fluid. And over time, that fluid will dissipate and it won't provide that shock-absorbing cushion as well. Now you can imagine, I view the disc as like a sausage. The disc has a nucleus pulposus, which is basically soft fluid in the center, and then there's a lining around the disc. Now what happens if there's some major trauma? I always like to use car analogies, because I think everyone has a car and they can think of the car like the tires on the car. Over time, over 30, 40, 50, 60, 70,000 miles, those tires wear out. And what happens is that the lining of the tire can rupture and break, and that can lead to a disc shooting out. And when the disc shoots out, what happens is that it can come back and pinch one of the nerves that is coming out from the neck. When that occurs, not only do you get neck pain, but then you start getting pain to where that nerve is going. Where do those nerves go? Those nerves go down to the arm. So typically, you get neck pain and pain shooting down the arm. What do you call that? You call that cervical for neck, radiculopathy, because it shoots over a radicular pattern, which is down, basically down the arm. I hope you found this talk to be effective. If you have any questions, feel free to contact me through my website at www.drharoun, that's DRHAROUN.com, or you can call my office at 410-646-4800. I thank you.